So we've actually spoken about the individual treatment for different types of pneumonia, where we spoke about treatment for community-acquired pneumonia, spoke about the treatment for ventilator-acquired pneumonia, then also for the hospital-acquired pneumonia. Do you understand? So here now we're just trying to look at the general treatment, general approach towards pneumonia. Let me say a patient came to the hospital and they are so much in distress. Do you understand? You don't really have time to start taking all those history to know the type of pneumonia, but you're actually sure that this is a pneumonia. Then let's look at the possible treatment that you can just start up with before identifying the specific type of pneumonia. Do you understand? So let's look at the various treatments. We're saying that treatment for pneumonia is dependent on the severity, dependent on the condition where you are seeing the patient in, okay? It's also dependent on the type and also what the cause of the infection, all right? So here are some treatments. Now, if our treating is based on how the condition in which the patient presented, did they present with a mild to moderate type of pneumonia? Is it a severe one? Do you understand? So there's different treatment for mild to moderate, there's different treatment for severe. Then there are also some specific treatment. This is when you are now be able to now identify the specific thing that actually caused that pneumonia. Do you understand? Also supportive care and prevention. So for the mild to moderate treatment, you can use things like oral antibiotics. You advise the patient to rest and relax. You opt in for fluid management, that's hydration. Then also pain management, that's what drugs like acetaminophen. Then oxygen therapy if needed. Alright. Then if it is severe pneumonia, you hospitalize the patient. That means you admit them. After you admit, you give some intravenous antibiotics. Now, can you see that for the severe one, they are not using the mouth, they are using the veins to administer the drug. All right, so that's the difference. The respiratory support, of course, is needed, like oxygen therapy, mechanical ventilation. The fluid management, you have to rehydrate, you have to resuscitate the patient. Then pain management too, then cardiac monitoring if necessary. Then for specific treatment, if you have identified that this type of pneumonia is caused by a bacteria, then you have to opt in for antibiotics like what? Amoxicillin, then ceftriaxone. Then for viral pneumonia, you opt in for things like antiviral medications like what? Oseltamivir and Zanamivir, okay? Then for fungal pneumonia, opt in for antifungal medications like what? Fluconazole and I just remember something. Let me write it down. Fluconazole and amphotericin. Then for pneumocystis pneumonia, opting for drugs like what? Trimethoprim sulfamethoxazole. Alright, so I think those are the drugs for that. The supportive care, definitely, everybody should know this. You're just trying to resuscitate the patient. The prevention, you get a vaccine, stop smoking, good hygiene, then avoid contact with people that you know that have pneumonia, or avoid going to places where they have reported that there have been recent outbreaks of pneumonia. Right. So guys, I think that's it for the possible treatments for pneumonia.